everybody. Welcome to All Things Odd. Today we have a fun show lined up. So I'm actually just going to be talking about some of my experience that I've had doing some mission work. So I know we always get a lot of questions when we share out our photos and everything of, the philanthropic mission work that we've done. And so we just wanted to take today's show and let me kind of highlight the group that I've traveled with. So Dr. Phillips is kind of working behind the scenes, and she's gonna put up some pictures, and then she also has some questions generated that she's gonna pop up for me. And so I can kind of tell you about the organization that I traveled with. So I have only gone once with this organization. It's called Faith and Practice. They are a Christian US-based nonprofit organization. They only do missions in Guatemala. And if you get on their website, it kind of shows the poverty statistics. The healthcare system in Guatemala is pretty broken. And so, access to hospitals and surgical services and things like that are really not accessible for a lot of people, especially in rural parts of the country. And so the way I got involved was I was randomly on Facebook one night and I was scrolling through, some of the different audiology professional pages. And I saw that someone had posted seeking an audiologist for a 1-week mission trip in Guatemala. The person that they had lined up, the audiologist had to cancel her trip for whatever reason. So they were looking for somebody to fill a spot. And I majored in Spanish in college. So have some Spanish skills. And I've always wanted to travel abroad and, be able to help people as like a medical mission. So I got my opportunity. And so I saw this post and I messaged the person who posted it. Her name's Jill Bernstein, and she is in New York. And so she was looking for somebody to travel with her. So we connected on Facebook. We talked on the phone a couple times. She had traveled with this group 6 different times. And so she really knew the organization. She trusted the system. She knew that it was a really good organization to travel with. She was safe. All the accommodations were great. So anyway, she invited me to come with. So in February 2020, right before COVID happened, I went on my first trip there for a week. And we're part of the rural village team. So we went to a few different rural areas, but there are multidisciplinary teams that only stay in the cities to do, hospital missions, so surgical missions, things like that. And so that's kind of how I found the organization. And I was supposed to go back this year in February, so I would have just gotten back, but the trip was actually canceled just because of COVID implications and everything like that. They're trying to reschedule later this summer, and I won't be able to attend those dates. So I hope to be back on the team in February 2023, and we can travel to Guatemala again. So let's see. Yeah, Natalie's got some pictures here. So you can see these. We went to 2 different schools and we set up, on a day, like on a Saturday or something when there wasn't school, we were in the building and we set up all of our equipment. I was on a team of about 40 people. And so it was a multidisciplinary team. There was general practitioners, pediatricians, pharmacists, dental team, gynecologists. And so we would, kind of triage the patients and see who they needed to see first, or which medical needs they had that were most pressing. And patients that had, let's say they were diagnosed with like high or low blood pressure, we would provide 3 months of medications so that they can, have access to those medications and then give them resources to get those, refilled so that they can continue the healthcare that's been provided. One thing that Faith and Practice does that's really different, I think, from other organizations is they work really strongly in the community. So they have a really strong presence in Guatemala, and a lot of the people that work for Guatemala or that work for Faith and Practice in Guatemala are locals. And so they know which areas need help, how we can best serve these people. They have all the cultural information, and it was just a really, really interesting team. So there's a Guatemala-based Faith and Practice team and then a US-based team, and they work hand in hand to make sure that where we're going, is filling the need and things like that. So I was really impressed by that. One thing that when I first got there, we stayed in Antigua. And there is a location of Faith and Practice there called Casa de Fe, so House of Faith. And what that is it's kind of like the Ronald McDonald House for this organization. So what they were finding is that people would get surgeries. They would be able to sign up to have surgery or whatever care they needed, but then they wouldn't have anywhere to stay in the city. They would travel from the rural village, come to the city, have their procedure, and then like sleep on the streets. So this organization, was formed so that people and their family members have a place to stay, which is amazing. They cook meals, they change the bed linens and everything like that. And so that way the patient can travel to have the procedure, bring a family member, and have a safe and no cost place to stay while they're recovering from whatever procedure they had. My experience was great. I would love to go back. It was so humbling for me, and I think that anybody that's in a helping profession, it kind of takes you outside of yourself to see how other people live on a daily basis, whenever we're so quick to complain about our first world problems. So I do think it changed the way that I practice audiology because it sort of hit it home. We saw a lot of patients there who worked in factories, so like sugarcane factories, worked around noise, and just had no idea that wearing earplugs was important or that it could help prevent hearing loss. Because of the government in the United States, OSHA mandates that, if you work in a certain environment that is over a certain noise level, they have to provide you earplugs. So that's not the case in Guatemala. And it really just the education is lacking on, hearing loss prevention. So it did change the way that I practice audiology because I think it gave me a greater world perspective, but then, also showed me how some things that we take for granted here, like the education about hearing loss prevention, is not something that's available to everyone. So that was really awesome. And, we saw children, we saw adults. What we did on the audiology team was perform basic audiometry for patients. And then we had some hearing aids, and we had to be a little bit choosy about who qualified for the hearing aids because we only had a certain amount. Typically in the United States, we would fit somebody with ear molds, so custom made ear molds if they have pretty significant hearing loss. We use something called Insta molds, which are, not necessarily made to be permanent long-term solutions, but they work really well. And, we're able to teach patients how to clean them, and they serve the need that we don't have the time to go there and take impressions of the ears and then come back 2 weeks later. So, we bring those so that we can fit people the same day. And we provide them with batteries and, counseling on how to take care of the instruments. And then they're put in contact with somebody from Faith and Practice so that they can receive follow-up care later. And so I'm just kind of following along with the questions here. The patients came from the villages that we were in. So we went to 2 different sites, and they were, instructed ahead of time to show up at early in the morning. And then, first in line, we would kind of triage the patients and send them to whichever sort of specialty department they needed to go to. And so we had a really steady flow of people. We removed a lot of earwax from people's ears because there was several people that came in, it's not that they even had hearing loss. It was just a really excessive issue with cerumen. So doing cerumen management, that makes a big difference for people, which was really awesome. So we had patients that were, really coming from the rural villages. So, a different population of people. And I remember we had one guy who he was from a different rural village, but he had traveled to come to our clinic, and he really needed hearing aids, but we were out that day and we were going to be back the next morning, and we had new hearing aids that we could bring and give to him. So I told him that if he came back the next morning that we would be able to fit him with hearing aids, and he said that was no problem. And he stayed the night. He slept outside the school in the yard. Just because, he didn't have the transportation and he really wanted to be fit with the hearing aids. And it was so touching because the next morning when we got there, the patients that were waiting for that day, he had made friends with some other people that were waiting, and they were feeding him breakfast, and he was so grateful. But it just, it's such a different experience. So that's kind of, where those patients came from, and how we found people that needed the assistance. My next trip right now is planned in February 2023. I'm on a team that goes every February, but the last two, have been canceled or rescheduled due to COVID. So I'm hoping that, once restrictions lift and things, kind of even out, that we'll be able to go back every February. So right now I work with Jill, that audiologist that I found on Facebook, to be, kind of the audiology team with her. And so there are many other teams through Faith and Practice who travel to different regions that go at different times. Anybody who's, watching this that can translate from Spanish to English, or, is a nurse, audiologist, doctor, has any sort of, medical skills. If you get on the Faith and Practice website, you can apply to be on a team. There may be a team that's desperately seeking an audiologist that you could, hook up with. But it's not just for audiology too. We had several nurses and translators and, people that were helping in other capacities as well. So that would be one way to get directly involved, is to, volunteer yourself to travel with Faith and Practice. But they also, have a Share the Mission fund. So they collect funds to help our teams get there and get the supplies that we need. As everybody knows, hearing aids are, not easy to afford for some patients, and especially going over to Guatemala, we have to bring a lot with us. I personally accept, donations from hearing aid organizations, or, anybody that wants to support the mission. But if anyone watching wants to financially support, Faith and Practice, you can get on their website and there's ways to donate to them. But yeah, we wanted to take this time to kind of highlight our philanthropic efforts, but we get a lot of questions, especially from, doctorate students, about our travels abroad. And so although we haven't been able to go really recently, it's a big part of our practice and a big part of what we do. So I'm grateful to be part of that team. And if you have questions, feel free to comment, reach out. We can get back to you. You could also visit faithandpractice.org and find out a little bit more about the organization. So I know that was kind of a short and sweet episode, but we wanted to get that information out there. And we will be back next week. We'll be here every Thursday at 12:30 Mountain Standard Time on All Things Odd.